Hey everyone, welcome to another episode of our Home Health Success Academy business podcast, where we will talk to a lot of individuals out there in regards to starting an agency, questions about marketing, or at the very same time as we also bring in individuals that can also help your companies, like administrators, as well as software engineers and companies that can make your company stand out from the rest. In this video right now, this podcast, we are talking to a marketer, and we wanted to be able to, find out what are problems that are being faced by a small time business owner, somebody who's just starting off their agency. So the person we're talking to in this video is somebody who's starting their agency and they're trying to find out, how am I going to get more patients? Or how can I solve this problem of getting people to know who we are? They don't have time to market. So that's what we're going to be answering in this video podcast. So we want you to be able to join us in this podcast. Always remember, this one is sponsored to you by Medication Reminder Program. If you provide a medication reminder program for your services, it's going to be able to make you stand out, which is a program that makes you different from other agencies, which may increase your referrals to your company. Also brought to you by Homecare Answering Services, a home care answering service that provides answering for 24/7, 365 days a year, including the holidays. So stop missing those midnight phone calls or those late calls from either your employees or potential referral sources. Also brought to you by 10xpatientreferrals.com, a platform that provides you all the training and education for you as an owner, as well as marketers, to be able to learn how to increase your referrals for your agency. Let's go ahead and get started with this video. All right. So what? When did you decide to start with to open up a home care company?
Ooh, like about 15 years ago. But I wanted to start with some partners, but they weren't moving with me the way I was moving. They didn't have the passion I had. So I said, okay, well, I'm going to just do it by myself. And so I went back to therapy school, and I was like, okay. Then when I found out Trump was going to be the president, I said, okay, he's going to do some changes with everything. So I was like, let me go on and do my first thing that I really want, my first love, which was the home health business. Let me get that off the ground before everything else started, because he's going to do away with the financial aid and everything.
Got it. All right. So so you finally got the license. Where are you right now? Like what's if I ask you like three main obstacles you're facing right now, what are those three obstacles so we can kind of solve slowly?
Well, one is having time to go advertise, like in the community, like going to not locally, but like to the outskirts. And the other thing is cause like sometimes if my skin break out, I don't feel confident. Sometimes I get shy. That's one of my biggest.
Okay.
So I had went to my dermatologist and bought some more stuff, and it's clearing up. So that was one of my biggest things. So I had got my wardrobe. So now I just need to get me like a name badge. And I wanted to be a network too. I wanted to have like all my ducks lined up where I'm in network with an insurance company. I want to know a little more about the billing part so I can know who I can bill, so I can who I can excel. Because I really didn't want to turn away people. And I know a lot of people say they don't really want to do Medicaid, but I was just like, well, who's gonna take care of the Medicaid people, even though they don't pay much? I was like, if I have to take care of them, I'll take care of them. And if I have to pay aides more, I would probably have to end up giving them like some of the private pay people or whatever. But I didn't want to just single out the low income like that, because it's a lot of people that really don't want to do those people like out here. And I heard some people like in Atlanta that told me, I talked to one doctor, he said he just got rid of all his Medicaid because he wasn't paying enough to pay the caregivers bill. And out here you have to pay the caregivers bill because they got some attitude. And it's like if you don't respect the pay part, it's like they don't respect nobody, not even the supervisor, not even the client. So I wanted to hire good help, and I've been working different places, and I've been seeing who don't sit down, who keeps working, and who gonna treat my people good.
So the first one, just the time, right? So that's time. Time is money, and we need to make sure if this is a business that you want, you have to put some time in. But at the very same time, I definitely understand that you have to work your regular job to try to supplement to hopefully start building it up, right? But
and I was taking care of somebody too for like 6 months, and
you
I
want
was
what?
trying to help. I was taking care of someone when I got off my second job for 6 months, and I was trying to get his insurance and stuff through because somebody kept calling me and they said the other home health didn't want to pick him up for some strange reason. I figured out why it's because of his attitude. Because when I got to his house, but before I had went there, they kept calling me and said, "Can you help this person? He's needing help. He has no family. He keeps collapsing in the kitchen. He blacks out, and he has no hands." So I went there and I seen him, and he has a lot of mental issues, and he curses a lot. He goes off on people quick, and I see why a lot of people like drop him. But he fell in love with me, and he was like, "You know what? You're the only one who really cares." And he don't have a way to go nowhere. He had to ride the bus. He can't even. He has cooks, so he can barely do anything.
Got it. So, yeah, I mean, it's unfortunate sometimes. I mean, if we all go through that, sometimes we have that moment of like, do we take care of them and just do it as a freebie, or, and, you know, God knows we want to help everybody. But the truth is, if you're not keeping your company afloat, you can't really do those things. Now, if, let's say, for example, it gets to the point where, you can make sense of giving somebody some free service, then that's up to you to do that, right? But first, you have to take care of yourself and then take care of your company, right? So, looking at the time, that's the biggest thing, right? So, what are you work night shifts, right? So, what are your shifts that you work?
Just night shift. I supervise two floors in like this they call the penthouse suite. It's not a regular type of nursing home. It's built like, up in the sky. Like, so we have like 19 floors there. And I guess it's like for the filthy rich people. So they got to pay like $250,000 as a deposit to be on the wait list.
Well, what time do you work? I mean,
10 to 6.
And 10?
10, like 10 at night to 6, like 7 o'clock in the morning.
Just 10 to 7. All right. So that's 5 days a week?
No, it's like a X and Y Z schedule where you can work 3 off 1, work 4 off 2, work 4 again off 1 type schedule.
Okay, so you can at least plan at least a month ahead of your marketing, right? Because you know your schedule. Okay, so unfortunately, there is going to be some time where you get off at 7. It's up to you if you want to start going out, but most of the places don't open up to or somebody available to like after 9:30, right? So you have two choices. One choice that you have is get home, go to sleep, right, and start marketing maybe like around 1 o'clock or so.
Okay.
Which allows you to have 4 hours of marketing time in a day, right? So on a Monday to Friday, so pretty much you have half a day of marketing every day available that you can do, right? This is where unfortunately you're going to have to split up your hours of sleep. Either 4 hours, 5 hours in the morning.
Watched your video last night, which was awesome. And I always was like against that SEO. But I noticed you said that, and you said something about marketing. So I had went online last night and put in Indeed offer for like a marketer, like a job, and I was going to do it commission based. And I was going to ask you how you feel about that. Is that a good thing or bad?
Outsourcing my marketing?
Because I told you I get kind of shy, and when it comes to approaching people, and then I don't want to be discouraged. So I was like, what if I hire somebody that was real bubbly and that was outspoken and that can help me out with certain areas?
I totally believe in, the way to expand your company, like for me wise, when I first got started really is in the whole training of marketers was that, when I started seeing success going on with the stuff that I was doing, I was like, is it replicatable? Can I replicate it with somebody else? So it's okay to bring in a marketer for you, but I can also say that the question is that marketer good at what they do? Right? There's one thing where you're talking to a friend, one-on-one and all that stuff, but the question is, just like as you and myself, are you going to have, are they going to have problems facing people face to face? Are they going to be shy about it? right?
Mhm.
So, with that said, is if you bring in a marketer, you want to be able to make sure, number one, you know, it's that you can actually plan out for them what you want them to do. And then the next question is, when you have that straightened out, then they go out there in the field, and are you able to see that they're doing what they're doing? And then the next thing is like, you know, how are you going to manage them? It's okay. The truth is, if you can bring in a marketer right now, if you have the funds to bring in a marketer, then that solves a lot of your problems, because then you just have to make sure you monitor them, right?
Mhm. I
So
was thinking about I was give them like a 2-week trial, and I do role play and show them how I want them to present the material. And then after that, I was gonna do like a role play with them, and I'm gonna act like I'm somebody that's not interested, and see how they'll come about, trying to face that, and then give them a goal to reach like 2 people or one person a week. And I want them to do call outs too. And then I want them to go do on site visits to different facilities. And I want somebody that's not scared of the corona and all that. And I want somebody that's like can talk fast, because you know how they say a person only can grab your attention for like 38 seconds or something like that. And you gotta have some real good info to give them to where they'll stop and pay attention to.
completely agree. Here's the thing. What is that great info that you want them to say? Because you have to give that to your marketer,
I gotta create it. That's what you here for.
right?
I gotta create it.
So I
Yeah.
mean, we all want, what you just described as the perfect marketer,
I'm listening to you. You're the
right?
expert.
So
You have my
so and you're talking about role play. So like, my team, my marketers, they role play every day.
oh, okay.
Like my marketers will, which is amazing, because they will literally hit on each other with role plays and give them objections. Like, like for example, just right now, I have you on the phone, right? I have you right here, face to face, me right now, right? Tell me about your company.
Whew. Well, we started in 2017. Well, I actually got the LLC in 2017.
Pretend that I'm a social worker and you're marketing to me. I say, tell me about your company.
Well, we're non-medical. We have 19 counties in the state of Texas. So if you're anywhere around here, we can cover that area. And right now we're with Superior Health Plan. Um, I have the PHC, which is primary home care, contracted, in the veteran contract. What else? Right now I'm doing a 2-for-1, which is if it's a couple, I'll do them for the same price, but they have to be in the same house. And I'll charge in like 2,100 a month, but it'll be like Monday through Friday, and they get like 3 hours a day. That's one of my specials that I'm thinking of doing.
So you can only do
So
Monday to Friday.
just for the couple that's special, yes. Like I'm giving like a discount, so I'll take care of 2 people, but they have to be in the same house, and they get 3 hours. What you think about that?
Okay, so we just did role play. So where out of everything that you said helps me as a social worker?
Well, let's say you have a rehab hall and your people is finna discharge and they need somebody at home still, or you think they're not gonna be good at home, like they might still be trying, they might keep continuing to fall. Um, I would suggest they need some kind of assistance, because if they get assistance, it'll prevent a lot of return, especially if I'm in a hospital setting and I'm talking to a hospital social worker. I'll be like, well, so you won't have to keep having the same person be readmitted. If you get somebody that can actually stay there, they say it saves a lot of money for
So how do
Medicaid.
you prevent patients from going back to the hospital?
By having somebody by their side, like if they need to reach something that they really can't do, or if they out their mind and they really don't know what's going on, or if they want to constantly stay home. So I came across people like that. They don't really, they're in denial about what they can and can't do. And some people still be trying to drive, and they really shouldn't. Some
Okay,
people,
so what we're doing right now is you're going all over the place with your presentation, right? So number one, you just start talking about your company. At any given point, you have to understand when we're marketing to social workers, the first thing in your mindset always has to be, what can I do for them?
Well,
Or the social worker. You're talking about patients right now.
mhm,
A lot of people don't like my comments about what I'm about to say to you right now when it comes to this part of marketing, right? So you have your agency, there's the care for the patient, right?
mhm,
Who cares about that patient that you're not caring for yet? Who cares about that patient that the referral source you're talking to right now have? The reason for why you shouldn't care, start going about that, is because it's not your patient yet.
mhm.
So the thing that you have to provide solutions for is the social worker.
Well, I know some social workers, they say that they just want to get rid of their resident. Like they just want to hear them get them out their hands. So they say if you the first one to call, well, if they call you, are you gonna respond quick? So I know to answer the phone and take that patient off their hands. Like I
Okay.
heard that. Like for those who answer quick, don't like have to wait for them to call them back.
All right, so perfect. So that's a problem faced by social workers, right? Getting them off their hands, right? So good. I'm glad that we're starting to get to that point. So the thing though right now is, what you need to do is you need to structure your presentation. So when I go into front of a social worker and they say, tell me about your company, I'm like, hey, listen, I definitely want to tell you about my company. But before I tell you about our company, what are three things that made you choose to work with agencies in the past? The reason why we ask that question is because we really want to find out what is their buying criteria. There's no sense in presenting your company yet without finding the problems that you can solve,
Mhm.
right? So when you ask that question, they start telling you, hey, share me, tell me three things. And what happens is, when it comes to sales and marketing, the truth is whoever talks less wins. And the reason why that is a statement that we make is because if they talk more, we ask a good question, they talk more, we get more information about them,
Mhm.
which makes us win because we can solve their problems.
I agree.
So you need to start, you have to work on your presentation strategy, right? So
Mhm.
if I ask that question, they say, hey, you know what, we're looking for an agency that's good at communication. And communication, mind you, is could either be a problem that they're facing with current agencies, and is that's what they're looking for. You see what I'm saying?
Mhm.
So now they say it's communication. All right. Now I can have a presentation based on the communication, right? So if they tell me, well, Michael, I want an agency that have good communication. All right. So now in my mind, I already have one thing I need to do in my presentation because that matters for them. Okay. So number two, the next question would be like, if there are three things that the agencies you're currently working with can do to provide better care for you and take care of your patients, what would those be? So those are two main questions I have to ask first before I even do a presentation, right? And the reason why those two are asked is, number one, what's your buying criteria? And the second one is me literally asking them, what stupid things are your current agencies doing right now that you don't like? But I'm doing it in a nice way. By me saying, if there are three things that the agencies you're working with right now can improve on to provide better care for your patients and take care of you, what would those be? By asking those two questions, now I have a presentation. So, like you said earlier, right? When you were telling me they have problem, they want somebody to take the hard patients off the hand, right? Take them off their hands. That's one thing. Guaranteed, solutions, right? They want somebody that can, have good communications. You accept a lot of these different payment sources. So sometimes it's the payment source. Okay. So if they say those three things that really correlate things, now I'm like, hey, listen, talking about communication. This is what we do to provide great communication and why it matters. So if we talk about communication, how is it that your agency does a good job of communication?
We answer that we respond faster.
The what?
we respond faster, and also like if you need a place to stay, we can help with that too.
Respond faster. Okay, so fast for you is different from fast for Usain Bolt, right?
Mhm.
So,
And we
you
have
know, having
a house.
having those generic terms, I'll say something like, hey, listen, communication is an amazing thing. Just to let you know, you have an ability to be able to contact me as soon as you want. You call us by phone. This is our phone number. If you need to, at nighttime, we even have a 24-hour call center that answers our call for us, so we are available 24/7. And at the very same time, is if it is an emergency, all you need to do is text me on this number. What I'm doing here is I'm painting them a picture of the communication status on how we do it, right? So if you text message me, you have me right away. You call me, that's great. If you even want, here's my cell phone. You can call or text me there. At nighttime, we're available, right? We're available 24/7 because we make sure that we answer the phones even at nighttime. This takes care of the family. This takes care of the patient. This takes care of you as a social worker. So you have to position yourself, and it's up to you how you want to position that, right? And solve that. For us, for example, our home care companies and our home health agencies, if a social worker wants, they can even contact us, via video chat. Our receptionist has a video chat capability in her computer, so that if they want to talk face to face, they can do that with us. So that's communication. So when you say response fast, you can say, hey, listen, if you call our phone number, guaranteed somebody's going to pick up the call within 3 rings.
Yeah.
That's fast.
Okay.
Right? Because that's the main thing. And you'd be surprised how many agencies lose referrals because they don't answer the phone. Because guess what? If I call an agency, if I'm a social worker and I call an agency and say, hey, okay, I have a referral. Let me go through my list. Let me call the first home health agency. They don't answer. Guess what? I'm calling the next one because I'm busy as a social worker. I need to just like you said, I need to get rid of this patient right now. I need to do my job and do a referral. So if you're answering the call an hour later, 15 minutes later, they already referred it to another agency. Think about it when you're thinking about buying something, right? You go to Google. You go to the first list. If you don't like that, you go second list, third list. So what's fast? Fast for you is different from what's fast for me. I'm a slow guy. I don't run fast. But the thing though is you have to create procedures within your company that you can handle that so that if a call's made, it's answered. Whether you hire a call center company to do it for you, if you can't answer the phone on time, or you don't, right? So we have a call center that we have. We have our own call center. So that's the thing right there is making sure that the phone is being answered. So that's fast for communication, right? So, and then getting rid of hard patients. I'll be honest with you, I don't like hard patients, right? But in the beginning,
they'll try to give you the people that's been kicked out of 8 nursing homes in 3 months down here.
Yeah, I mean, hard patients. When you get to the point that you have a lot of patients, you can kind of choose and pick a little bit. When you start seeing a patient being a little bit hard, right? That's when we start calling another agency. Hey, we have a patient. Do you want it? We give it up, right? Because I don't want to put my staff into that and lose a staff member. But in the beginning of this business, guess what? We can't be picky, choosy people, right? We just accept who we have and make some money out of it. But we have to make sense that we're making money from it, So, I mean, the main thing is in your presentation, you have to structure it, right? What I saw when you started doing your presentation was that you were starting to try to think of what goes on, right? And so you have to really double down and actually sit down and have your full presentation set up. Like for us, we're going to ask the 2 questions, right? Once we start having the 2 questions, we go with the 3 positives and we say, okay, let's talk about the 3 positives that they want. And then we hit them with the 3 negatives, the 3 things that they don't like about the agencies. that they're working with. Then we double down with that. And then, and then if there are certain things that wasn't discussed, then we start saying like, hey, listen, just to let you know, this is what's important, what makes us different, right? So, I'll give an example. For our agency, we provide all our patients with call buttons. So, the reason why they have call buttons is because I'm sorry?
You talking about this thing that go on the neck that they can call for help, like 911?
We do that also. But we also have so how like back in the days, if somebody, if somebody like in Europe, somebody wants their butler to come in, they ring the bell, right? Or actually in a nursing home, they have the call button in a nursing home, right? If they need to call somebody. So our caregivers, even if they're in the patient's house, they're not there. They're not going to be in the same room with them all the time because the patients need some privacy, right? They need some privacy. So actually, hold on. I have it here. Just plugged it in the other day. So, here's, for example, a call button. This is a sample of the ones that we give to our patients. Okay, it's plugged. So did you hear the bell on the back and the outside? So what ends up happening is this one has a receiver. It's plugged all over the house. So if the patient wants the caregiver, they just press the button and the caregiver knows that they're being called and they come to the patient's room. So, so we have like what makes us stand out, right? So those are little different, some different stuff. I'm trying to find. I don't have my call button here. I don't have one. I don't have an actual one.
How much is that?
But how much is that? $25 in Amazon.
And you have to install it in the house? Or
no, it's battery operated, and then the receiver, it just plugs in the outlet.
What's
So, I'm sorry?
What's the name of it?
Just look it up, call button in Amazon, and you'll be able to find something like that. But so,
okay, I thought about that too.
Yeah, so when we do stuff like this, we show this to a referral source, because the thing is, when you ask the two questions, you now have the solution, right? You have the problems and the stuff what makes them choose an agency, and what are their current problems with their agency. Then we present to them those things first, because those are what's important to them right now. They don't really care about light housekeeping. They don't really care about skilled nursing. They don't really care about caretakers or we cook food, nutrition. They don't care about that stuff right now. What matters the most right now is not the patient for them, but we as human beings, we are naturally greedy people. We're selfish people. Nobody wants to admit that, but everything is about me. It's not about you. It's not about them. It's about me first. And nobody wants to admit that, but it's natural selection. It's just a natural thing that goes on with human beings. And understanding that is what's important in psychology of marketing. So if we understand that, what can I do for you first? Because if I can help you first, guess what? You're then going to reciprocate, give me a patient, and then I'm going to help the patient. And when we get the patient, take good care of them. Provide the best service. Really make sure that they're taken care of, right? Because now, when you get a referral from them, if you provide great care for the patient, they see that, then they give you more. But for the beginning, before they start referring to you, you want to make sure that you're helping them first. So when I find out those 5 to 10 different things that's important to them, okay, I present that. Then whatever's not discussed from what's important, I'll talk to them. So you talked about, for example, the hard clients, right? Taking them off their back. The way I would do it is on the presentation is tell a story, right? So, I'll say something like, if you're talking about your heart patient, like, what we work with a lot of agents, a lot of referral sources in the past, and when they have that one tough patient where for some reason they're not able to find the right, home care company, or that patient is going home the same day and they really need to find somebody right there and then, that's one thing that we want to be able to be part of. We want that hard patient and take care of that for you. But at the very same time, it's easier for us to provide care if we're doing more stuff for you. So you need to make sure that you set up your presentation in that manner. Okay. So that's just one thing. The next thing I want to do, let's see here. Did you get canceled out? Are you still there? You there? Okay. We got canceled out there for a quick second. All right. So, but yeah, so that's the presentation you have to do. You have to first ask a question, structure that, figure out what you need to be able to do. Now, and the communication, like we talked about, is important because that's how they can refer to you. The next thing is, well, the second thing you talked about earlier on today, right, was the whole when you break out, okay, that you don't have the confidence, okay. I can't help you with that. I have bad skin, so just to let you know, don't let that get to you, right? The thing though is, we're all gonna have some form of insecurities. We're just there, right? I have my insecurities. I got white hair growing. I found a white hair in my nose the other day, and I'm just crying. I'm like, I'm old, So so I'm just saying is that listen, it's okay. You'd be surprised how the stuff that we're so conscious about that people don't even notice.
Yeah, that's true.
And
It looks fine to me, but yeah, I see what you're saying. Thank you.
yeah, don't let that get to you. I mean, and the truth is this: when they meet you the first time, it's not like they're gonna remember you,
Okay.
right? It's not like the chances of them really remembering you the first time that you visit them, they won't. They may not. There's that 50% chance that they may recognize you the next time, but that's it. So that's why in the whole marketing spectrum, the follow up is the most important stuff. If I follow up you at least 6-7 times, I have a higher chance that I'm going to get a referral from you, because then you really end up knowing who I am. Most marketers will visit once and never come back again.
Okay.
The reason why most marketers don't come back the second time is because they created their own internal objections. Oh, they're already working with another agency. Oh, they had a bad personality. Oh, they were rude to me. Oh, they didn't give me attention. Okay, number one, right? They were rude to you because you interrupted their day, maybe. Number two, they're working with another agency. Of course they are. They didn't just open their door yesterday.
Let me tell you what happened out here. I was working at this place, and I noticed that this lady, she had 10 people running around with her shirts on at this assisted living I worked at. And that was another thing that encouraged me to do it. I tried to talk to her. She was like kind of skeptical. She didn't really want to tell me no information. I thought she was a nurse. She wasn't a nurse. And I finally got to take time to talk to her. And then she told me that she charged about 18 an hour. And the facility, they only call her.
They what?
To have people come sit with the people at the assisted living. They had like 10 people that need like a personal assistant. So we had caregivers already. I was giving them out, and the caregivers, like we had like 2 caregivers with the facility that takes care of probably 55 people. And so I guess the family members want them to have their own private sitter, so they ask them if they know anybody that they trust or whatever that can come up there and have somebody to sit with. So they hired her people, and like every time something happened, whether they got a new patient come at night, they call her because they got that person. That person can probably take for something. They would call her, but she's not in the Texas website. She's not a certified agency. She's not a licensed agency. She's just somebody that just have their own private.
Some places have those kind of things setups, right? So.
And I talked to her, and she was just like, go to like one of those places that's not developed, and like they're going to build a new facility across the street, and it's being built and hasn't all the way finished. She said she'll go to those that and she'll try to like get in with them so they can get a contract.
Hmm. You know, one thing you should do is really, you know, so who are your targets right now, for example?
Uh, assisted living. So if I get a one assisted living, I think I can get them to where they'll have me come in for majority, like probably like 5 or 6 people in that one building that I could probably come sit with because it's a lot of us that need those, just sitters. And also, I wanted to do group home. But sometimes we have one group home that needs all five. Because I met one lady, she had like 5 different group homes. And only thing I didn't like about that was sometimes they are not right. Like they didn't want me to come at a certain time, and
Uh-huh.
then they would figure after they cleaned up everybody and the whole place smells good. I'm not here to judge, but I kind of got self-schooled with the group home, so I kind of steered away from that because it was my church. And the lady just didn't. One of the residents said they were trying to give me to take off my break out of here and start ringing bells for people and I'm like by the board and the cops arrested him one night for that. And he wasn't signed up with all the way because I was going to be on the sign up with the VA, this bed assist company, and they didn't finish signing their paperwork, so I can't even get him all the way. And I told him, well, I'm just to the doctor and give him some medicine to sleep so he won't have problems. And I asked to look at his room, and I looked at his room. He was watching a lot of old Western movies, and they were shooting. I said, you cannot do that with your patient. You cannot let him listen to all of that fighting, gun smoke like that. Like, you can't do that. Because that'll trigger, like, where he'll think he's back at war.
Okay. All right. So, you know, when we look at the targets, right? When we start saying targets, my main thing for that is you need to really write down who your targets are. So if you say ALFs, okay, perfectly fine. Which ALFs? So what you have to do is the first thing. So let's talk about the whole thing about the process of a marketing process. The first part is number one is your prospect. So you have to really choose who you can market to. So number one, you have 4 hours a day of marketing average, so 5, right? So 5 days, so that's 20 hours worth of marketing in a week. So knowing that, I would look into, because you should be able to visit 10 places out of those 4 hours.
Okay.
So that means if you can visit 10 places, you should be able to visit an average of 50 places.
We continue on to the video. Just need to be able to take a few seconds of your time.
This video is brought to you by medicationreminderprogram.com. Are you trying to look for that one edge up to be able to get you more referrals or to get new referral sources? Well, that's medicationreminderprogram.com. If you start offering this for your patients and future patients, you're going to be able to show future referral sources that you're doing something different, that you're providing better services than your competition. The daily reminder program goes like this. We will call the patients for you twice a day and remind them to take their medications at 9 o'clock in the morning and at 5 p.m. A top reason for hospitalization of seniors is not taking their medications. So what you're going to be doing here is you're going to be giving them comfort of mind, both family and referral sources. So sign up to medicationreminderprogram.com right now. There's 3 packages available, but at the very same time, right now, with code 50 off, you can actually get 50% off our Gold plan and the Platinum plan. So just stop by medicationreminderprogram.com and let us help you get more referrals. Let's go back to the video you're currently watching. In a week.
Okay.
Right? The next thing is you want to target the stuff where who you're going after is with close proximity. Don't zigzag across the county. Don't zigzag across the city. You have to really sit down and plan it out and say, all right, this one's closest to this one to that one. So you limit the amount of drive time that you have. Then once you have all that stuff, then you visit these guys once a week. Or you visit them every 10 days the way you set it up. So if you're able to do that, that right there increases your follow-up time if you can visit them every 10 days, every 7 days, every 10. That's up to you how you want to set it up. So now that's your prospecting phase, but you have to choose right now. I'll say you have to choose. I'll give you 65. Choose 65 potential targets between 65 to 75. That allows you to visit them once every 10 days. If you're going to just visit them every week, if that's your plan, then choose 50. So that's your ALFs, your assisted living facilities, the one that gets you referrals. Physicians, you're not going to get as much referrals. What you're doing here is you're maximizing the amount of time that you don't have, the very little time that you do have. I'm sorry. So that's
referrals. So are you non-medical?
the what?
Are you non-medical or are you skilled?
Both.
Okay. How many do you have in Florida?
One agency, we have 200. So my one agency in the Midwest has 235 right now, non-medical.
For non-medical?
Mm-hmm.
Okay. In Midwest?
The what?
You talking about in the United States, in the Midwest?
Yeah, we have so that's one agency in the Midwest. We have one in the East Coast, and then we have one as well as in the Southwest states as well. So that's the thing right there. It's just you need to create your target for that, right? So you need to create your target on who you're visiting. I know the return's not there yet because the money's not coming in yet, but in the beginning of everything in life, sweat equity is what it is, right? And you have to remove. There's only one there's only one result here: is failure, right? So that's the one result that can happen is failure in one end. But I choose not to go in the failure route. Let me just move forward where you can't see anything else yet. So, failure can always happen. I mean, look, people are failing every day right now with this whole COVID thing. I'm laughing right now, like here's the thing. It's like we're getting referral sources that we never got because a lot of agencies shut down. A lot of agencies stopped marketing, right? So if I'm getting new referral sources, some agencies are losing referral sources. Mm-hmm. So what are you going to do that makes you stand out? So right now it's, you're a non-medical home care company. Guess what? So is another 1,000 of them out there in Texas.
Yeah. It's a lot.
So you guys offer the same services. Now it's a matter of like, okay, how can I stand out? The way you can stand out is adding additional programs and services within your company and also improving the way you deliver the marketing strategy, the way you present it.
Okay. I have a question. Like, I wanted to do, like you said, do add-ons, nurse. Have you heard of that?
Have I heard of what?
Uber nurse.
Uber nurse?
But they come to your house and they check on you. I can like do a contract with them, and if something happens to a resident of mine, instead of going to the hospital, I can call Uber nurse and they'll send a nurse to their house.
I have not heard of Uber nurse. I try to stay. I run away every time I hear a company that says we're Uber of this. I kind of like, I kind of run the other way because you're comparing yourself with another company, and now it's probably one of those. They have an app, I'm guessing.
No, it's like, say, because they moved into telehealth. Right? This was before the whole shit happened with the telehealth.
Uh-huh.
So I was like, I'm going to get everybody to, get involved with this. So that's a good idea where you don't have to leave your house. The hospital can come to you. Where they can draw your labs, they can do they can test you for different things in your house. But it was like $75 a month. And it was just different stuff that they could do that nobody really knew about. Because most people still want to go the traditional route. But they came out with something different. And now I see how they're going to be able to implement it because now everybody's going to telehealth here. Like none of the doctors' offices open like that.
Okay.
So nurse, I was thinking to do that since I'm not medical, to where I wouldn't lose somebody that was medical, so I could call them and they can do a medical part for
Any which way that you can promote your company, do it.
me.
Any which way that you can, I say do it. There's nothing wrong with it. I mean, there's like a company called what do you call it? Care for Mom or something like that, and there's several other like referral source companies out there, and a Place for Mom. Have you ever heard of a Place for Mom? So,
That's what I
but
was trying to tell you. I was trying to get on that website, a place for mom.
yeah, so you have a Place for Mom, for example, right? So, what does a Place for Mom does? They're just a placement agency. Okay, how do they get placements? They advertise online. Okay, and the funny thing is when they get a referral, when a patient family member enters their information in the computer, forwards it to them, what they end up doing is they forward it to another 15 other agencies.
Yeah.
And guess what? Each one of those agencies pays them for the referral.
I tried that too. I didn't like it.
Right?
I
So
didn't like
the problem with that is we have that same mindset, but let's create our own funnel for ourselves. So our company, we're strong online. We do pay per clicks. We do Facebook marketing, which does amazing for us. Okay, so we do Facebook marketing for our home care company, and we get a lot of patients that way. But in the end, we still before you can start doing all that stuff is your website ready for it? Do you have everything in place in your company, like your brochures, for example? How are your brochures? How are your marketing? See, a lot of people want to jump straight to presentation and making money without taking care of their core, which is the branding of their company, which is making sure that they're ready for presenting. So I'll give you a quick example, right? What were the two questions that I shared with you that you should ask
you told me to ask like what things they don't like about agency
them?
and
What are the three? What are three things that the agencies you're currently working with,
that they don't like.
can do better to provide better care for you and take care of your patients? I will never ask a person a negative question like what are they not doing, or where are they failing. The reason why you never ask that question is because when you start asking that question, you're literally telling the person in front of you, you suck and you failed because you chose these agencies. So if you ask them what can they improve on, that's just a more positive note, but it means the same exact thing. Like what crap are they doing right now, right? So that's one. That was the second question. The first question was what? What are three things that made you choose to work with agencies in the past? Now, see, just right there, and that's why we do these training nonstop, is because you need to keep on hearing and repeating, right? Like fasting and all that stuff, and you have to keep on repeating that stuff and practicing it. So
ask them questions and let them talk more.
the what?
Ask them the questions, let them talk.
Yeah, ask them the questions. So first thing you need to do right now, like I said, is figure out who are going to be your targets. Who are the rich targets for you? And really where you need to go right now is straight into assisted living facilities, senior housings, and senior communities. Right? So, so find out those places in your area, map them out, and go after them. So, and then while you're doing all this, like, the next question you have yourself is like, I would spend a day of calling each one of these facilities.
Now, I did get a senior book from the grocery store and called around, and most of them like, oh yeah, you can leave brochures.
If somebody says you can just leave your brochures, I'm like, hey, perfect. I would love to leave my brochures. Other than the fact that I can leave my brochures, what are three things that made you choose to work with agencies in the past? Or what three things that made you choose to refer patients to agencies in the past? See, whenever they give me an objection, especially in the beginning, and I'm qualifying them, because It's prospecting, qualifying, presenting, closing, and follow-up. Those are your stages of your whole sales process. If you miss a part of those and don't do it right, you're going to have problems. You're going to start from the beginning. So when we qualify, so sometimes, if you don't prospect correctly, they really don't have patience, or you prospected the wrong decision maker in a facility. You're not presenting to the right person. So that's where prospect's important. Qualifying is like, do they have patience? So I'm going to start asking those questions, right? So, and then the presentation is where it's important, and then close, and then the follow-ups is where really you get most of your referrals. But yeah, so I mean, whatever you hear from these people, if we hear an objection, right? I don't have any time to meet with you. I don't have, I don't have any patience right now, or I'm busy right now. There's no solicitation. We're working with another agency, right? Hey, perfect. The moment I walked in the door, I already knew you were working with another agency. Other than the fact that you're working with an agency, what are 3 things that made you choose to work with that agency in the past? I'm there already, right? I get those questions. Perfect. There are things that they can improve on to provide better care for your patients and take good care of you. What would those be? I'll get those, write those down, put it in my head. Perfect. So then I'll just start saying, okay, communication is important for you. Let me go skill. Now, if I can do all this for you, if what I shared with you makes sense, can we try each other out? If I go A, B, C, D, E, F, G with all the stuff that they talked about. But yeah, okay, perfect. Won't be a good time to start taking care of one of your patients right now. So you have to be ready for any objections. You're gonna hear a lot of those things from these people. Every person's job is to get rid of you, right? Think about how many times have you given somebody else a cold shoulder?
Mm-hmm.
Think about how many times somebody tried to sell you something and you said you're not interested. Think about how many times that you walked into the mall and somebody tried to give you something, some lotion that's walking in the middle of that they're in the middle of the mall, and you said no, thank you.
Mm-hmm.
Guess what? Now it's happening to you.
You heard of those it's like where you buy leads.
It's a what?
Have you heard of those little different companies where you can buy leads? Like you buy a package of 500 and they send you 10 leads for $40 a lead. And they share only the lead with 3 other companies besides yours. Are those
lead?
good?
It's similar to a place for mom. It's all about leads.
Yeah, but it's another type where not just you putting it, because I think the one you're talking about, the place for mom, I think I should directly. Like I tried to get on one of those too. I didn't get a good look with that. And I haven't really tried but one of the lead ones, like care.com or something.
Care.com is another one. Care.com started off by providing babysitters. Then they got to the senior care. So that's where care.com first started. So, there's nothing wrong with lead generating companies, but my thing for that is that, what they're doing is they're solving problems for agencies that can't find the leads, so they're going to make their money off of that as well. There's nothing wrong using lead agencies. Care.com, we get a lot of referrals from care.com. But the moment the referral comes in, we call within that 1 minute. Because we don't want any other agency to call before us. Like we call, so that's where if you're going to get referrals from these referral sources, well, make sure that you respond fast enough, because why are you paying money if you're going to be the last person to call that person? So there's going to be a lot of those referral sourcing companies, and all they do is Facebook marketing. They do pay-per-clicks and Facebook marketing. That's where they make money. That's where they put their advertising in.
Okay.
Because if somebody clicks on care.com, and here's a quick thing, right? So let's say you're paying $40 a lead, right?
Mm-hmm.
They pay $40 a lead. I give it to 10 agencies. Care.com made $400, yet they only paid $20 for a pay-per-click on Google. That's pretty good profit, right? Right. All they're doing is online. It's online marketing is what they're doing. That's all that it is. So for us, for our companies, why we don't mind doing that because they're spending some. So we'll do pay-per-clicks ourselves. I'm willing to pay the $20 for a click, but I'm the only person being notified. Right. So, but right now, you don't have that capability to do pay-per-clicks because, for pay-per-click in Google, we're seeing somewhere around $300 ad spend is what we're spent, what we're losing is what for every patient that we get, we have to spend somewhere around $300 because there's gonna be people clicking that we're not gonna be able to close, right? So we're spending about $300 to get a patient. So so that's the cost, $300. But we're the only ones taking care of the patient. So that's more advanced marketing. But for you in the beginning, when everybody gets started, when there's not a lot of funds, it's all sweat equity and going out there. Should you hire a marketer? If your funds can say that you can hire a marketer, do it. But make sure the marketer has everything in their hands. They have their good brochures. And if you walk into a referral source and all you bring is a brochure and a business card, right? You're just like any other marketer. Is your presentation folder nice? Or do you have a presentation booklet? Do you have rack cards?
I have one.
So that's is that the one for your mailer, right?
Yeah,
okay.
That's the one I have that.
That's I like that because there's not a lot of paragraphs. Okay, so good. So you have that those are perfect. So you can even give those out to them when you walk in. These are what we do. Okay, so having those are things, and that's good. I mean, I prefer all that. I prefer two-sided cards rather than a brochure. And I prefer bullet points. So there's your trifold. And if you open up, is there a paragraph in there? Please say you don't have a paragraph. Is that the rack card, right? Back to back?
No, it's inside too. But I put the bulletins on outside.
Okay. Yeah. So good. So great. So you have those. So when when you go in, okay, perfect. There's not a lot of paragraphs. There's a bunch of bullet points. That's bullet points is always better. So just with that, you have to first work on so we figured out who you're going to target, pick 50 to 75. Then the next thing is work on your presentation. So how can you communicate better, right? That's number one. How can you provide, how fast is your service that you can do? Number three is, you're accepting a lot of payment structures, so that's great. What I would do is you said something earlier on about the 5 days a week, 2,100 or something like that for a patient, right? I would never go and say it's $2,100, right? I would actually take it to the bottom and say it's this much amount per hour. Because when somebody hears $2,100, they start freaking out in their head, rather than putting it out in regards for the hourly. I mean, we'll break it down to the part that's only 50 cents an hour. I mean, that's only, that's only 50 cents a minute. That's only, so divide it up. So what you have to do is don't go with the high rate, do the per hour, and then your price structure, you gave me a price structure that went from like 21 to 30 or something like that, or 35, which one is it? Because that's like you saying, for example, you're trying to buy a car. How much is the car? Well, it's going to cost you around $21,000 or $50,000. Okay, well, which one is it? Well, we have to do an assessment first. You go in and be like, you seem like a person who works. We're gonna have to charge you $50,000 for the same car. When the truth is, your caregiver is a caregiver. Are you gonna pay your caregiver $20 an hour if you're charging $35 an hour? No, you're gonna pay your caregiver the same price. Maybe give them an extra dollar. So why is it that you can charge $35 more, right? You're making it too, you're willing to take
15.
you pay them 15 an hour?
I wanted to pay them 15.
Hey, if you can pay them $15 an hour, that's perfectly fine. That's respectable.
But I was trying to get more private pay so I can pay that.
For us wise, our pay scale is at 13 is our midpoint, but we give bonuses.
Okay.
So our bonuses is in regards for if the patient remains with our services, the caregiver gets a bonus. If they stay with the patient, they get a bonus, right? Because, I'm not going to be like, hey, I'm going to pay you $16 an hour, and then you do a piss poor job as a caregiver. I'm going to give you this much first, but if you can provide better care, family's happy, patient stays longer, you stay longer so I don't have to keep on looking for another caregiver to replace you, you'll get a bonus from me. So eventually their structure goes up. So because I'm not gonna start off paying somebody $16, $17 an hour and then all of a sudden they're crappy with me.
Mm-hmm.
Nobody deserves it.
I was thinking of those lists are ones that I handpicked because I've seen how they work.
Mm-hmm. But before you can even take care of finding about caregivers, taking care of those people, you need to first get patients. Mm-hmm. That's the thing I want to really instill in you is that you need to start looking at really right now it's about marketing. That's where it is. Marketing is where you need to be at. So that's where you have to put yourself. Is your marketing needs to be on point. So I would seriously, be ready and good at and taking care of your presentation. So coming about that stuff, let's talk about communication, payments, and let's see here, and service. All right, just talking about those three. Tell me about your company. Just with those three things.
Payment, service, and what else?
Payment, service, and communication.
And you are a family member?
I'm a social worker.
We provide non-medical and we run errands. We can run errands. We can take them to the doctor appointments. We can do light house duty, light housekeeping. We provide meal preparation. We provide medication reminders.
Uh-huh.
We have toileting. We also can let the families know, like, if something's going on, like it's a change of condition and stuff like that. The payment part, we accept like credit cards, checks, cash. Also, still Medicaid and I would pay VA pension.
Okay. And then communication?
If you call, we'll respond within the first 3 rings.
Okay.
And if you leave a message, we'll listen. You can text us, you can call us, you can email us. But
okay.
All
right. So so you have all those. So let's you have to do it in a presentation. Pretend that you're presenting to me, right? Because if you're talking that way, I'm not going to give you a patient.
I'm not ready to talk. I don't really feel good.
I know. So
I'm not really
this is just
good.
practicing around, right? So the best way to do it for services is just look at your brochures right now. And when you look at your brochure, you should memorize it from top to finish. So if I'm providing home care, hey, the type of services we have is several things, right? We have companion care and a homemaker, right? But typically we provide light housekeeping. The reason why light housekeeping is so important is because the patient, unfortunately, with activities of daily living, they're not able to really do their own housekeeping. So our staff can do that for them. Because why? Number one, it helps with fall prevention because we make sure that there's no clutter on the floor. Number two, we keep a clean environment to provide safety for the patient and for them to be healthy as well. We provide errand running, right? We can either go with the patient or the patient can remain home and we do the errands for them. This helps the patient out, making sure that their groceries are, stocked up, then making sure that any toiletries or needed stuff, we can handle that for them. We provide light meal preparation, right? So we can cook a breakfast for them if they just need some basic scramble and eggs and certain things, we can do that for them. So what you have to do is you just memorize what you have on your brochure. You shouldn't have to say or think about it. You should memorize it in your brochure how it's listed. Memorize that in your head, and then it flows out really fast. Your information that's in your brochure should match out what comes out of your mouth and what's in your website. We start talking about payments. Yeah, we accept credit cards, checks, direct withdrawal. We accept several type of insurances. If you want for a credit card, we can either take the payment by phone, or we can email you a invoice and you can pay it online. Somebody says, it costs too much. Hey, I completely agree. We can get you a discount, but you have to pay up front. Like if a client says $29 an hour is expensive, I can say I can make it $27 an hour. Sure, let's do it. Great. How many hours a week do you need? 50 hours? Great. You can pay advance a week ahead. And I'll take $2 off. Right? It gives me the leeway. I'm charging $29, drop it down to $27, but you pay me a week ahead. And if they say, well, I'm not going to pay a week ahead of services. Well, you're going to pay me a week after anyways. What's the difference? I'm saving you some money. Which one was better for you? Well, I want you to charge me. I want to pay the bills at the end of the week. Okay, fine. What's your credit card? We can just do a direct withdrawal right away. We can automatically charge you 50 hours at the end of the week. No, I want you to send me a bill. Not going to work that way. Because if you can't pay a week in advance and you're worried that we're going to withdraw money or charge your card automatically after the week is done, and you're still complaining about that and you want to get invoiced, then we already have a money problem there. I already have a money problem with that particular client. Well, how much can you afford? I can only afford 25. All right, 2 weeks ahead.
Yeah.
Right? Every week that you wait, your mom needs help. So we can get started now. Can you afford this or not? See, a lot of times people are so tough. People are so not tough about asking questions that 2 weeks later, they don't get paid. And they're like, what happened? Well, you didn't ask the right question. You didn't ask these hard questions when you're because remember, when it comes to marketing, if you market to referral sources, they may refer a patient to you, but you still have to close the patient. The patient and the family still needs to agree that they're willing to pay your funds, the fee that you're charging. It's a two-part sale.
Mm-hmm. I had came across another problem where this lady called me. She wasn't in this town. She was in Austin, 5 hours away. But she was trying to get somebody to take her friend. And she said the friend had family members that was RN, but they don't have to take care of her. And they don't like to take her out in public because she's a hugger. And she goes up to people and hug them, and they don't like that. And she won't let them go. So that was she was like, oh, I really like you, but I know you just start the business, whatever, but could we have you? And it was like, if she couldn't have me, then she didn't want nobody else. Well,
A lot of people are gonna say that sometimes. Also, I'm like, oh, but you're such a good person. You should take care of my mom, but I can't afford you. I'm like, all right.
she said they can afford it, but it's like she wanted to talk to the rest of the family, but she acts like she don't want me. She's like, so what's gonna happen if you have to go away and start getting other residents and this and that? And I was like, I can find another person just as good as me, but I'll have it going there. But that's what she was saying, and I was like, hello.
I mean, the thing with with a lot of stuff is that we're gonna get the discounts, we're gonna get those kind of things, but you have to make sure that when you give discounts, that you're in the upper hand, right? Don't just give a discount just because if you're trying to be a nice person,
Oh
you
yeah.
know. So I mean, like for us, for example, you'll be surprised how many times I'll see a person. I think that they're going to be cheap, but then we give them the 29 rate and they say, "Fine, we'll pay it." So that's just how that kind of works.
Okay.
So I mean, have you watched the training yet? The COVID-19 thing?
Yes, I watched a couple of videos. How many is on there?
There's one main video in there, the 2.5 hours.
Oh, I watched a couple of them.
Yeah, so you watched some of the special ones, but the 2.5 hours one that I emailed you, that's where the main video is. So you can watch it 2.5
I
hours.
think I have like another hour left.
Okay. Yeah, so watch that whole thing. That just helps you market on the mindset of what's going on with COVID stuff right now, right? But if later on that you really need the whole process, you can go to 10xpatientreferrals.com. So we got like over 150 hours in there of training. I mean, it's just there. So I mean, it's month to month. It's up to you if you want to continue on with it. But that's just where it is. You're cold calling. You need to work on your prospecting, and you really need to work on your presentation.
Okay.
Presentation is important.
The 300 on there.
The what?
Is that the package you have for 300? The 10 referrals.
Are 230 referrals? You mean? What do you mean?
No, it was one that I thought was on for like $2.
I'm sorry, you're kind of cutting off. I apologize.
Is that one for $300? The package deal you had?
Oh, you mean how we're getting the $300? The referrals for $300?
Mm-hmm. No,
Well,
no. On your website, the 10x referrals, 10 times referrals.
Yeah, 10xpatientreferrals.com. Yeah.
What's the cheapest package deal?
The package deals, there's the 149, which is the silver plan, 289 for the gold, and then 8 something for the platinum package. So I mean, that's the monthly payments depending on which one you want. I mean, for you to get started, just use the 149 for now. If I were you, it just gets you all. You get everything in there. Each one of those packages, you get the same amount of information within the training. The other ones just has additional stuff, like for example, you get the medication reminder program. So we have our own call center, for example, that we handle all your phone calls. So if somebody calls in, we pick up for you, we answer for you, and those kind of things. So if you choose, let's say, the gold package, you get a silver package available for the medication reminder program. I mean the call answering services. So those are the additional stuff that we do. But if it right now, no matter what for you, it's really your training that's important the most.
Okay.
And your marketing. That's honestly where I want for you to go. And the thing though is you have to be consistently going out.
Okay.
You have to show consistency. You really have to go out there and market, and that'll be my best bet for you. So I mean, work on your presentation, know your products and services. And here's the thing, you're gonna, like if I haven't been marketing for a week, like if I don't market for a week and I go out and market, I guarantee you I suck the first day or the first few hours. you know, and because it's like an engine. You're just trying to you're trying to really slowly build yourself up. So the thing that you have to really do is really work on that for yourself right now. So just really really work hard. That's my best suggestion for you. Okay.
Okay. Thank you.
Yeah. So just choose. I mean, you don't have to just sign up with us with a 10x. You don't have to do that yet, but you need to start practicing and look in front of the mirror when you're talking. Like be in front of the mirror and making those and practice in front of you and record yourself doing it and then watch it again and be like, would I refer to that person that's talking in the video? And that's how you need to be able to handle that. Okay.
Okay.
All
Thank
right.
you so much.
Yeah. If you have anything, just send me a message and I'll answer back. Okay.
Okay. Thank you. I appreciate it.
No problem. Have a good day.
Okay.
Bye.
Thank you.
Now, before we continue on to the video, just need to be able to take a few seconds of your time.
This video is brought to you by one of our sponsors, HomecareAnsweringService.com. So our job here at HomecareAnsweringService.com is to be able to make sure that you stop missing any calls, because we're going to handle the calls for you 24 hours a day, 7 days a week, 365 days of the year, even during the holidays. So mostly we're going to be doing a lot of your after hour calls to be able to give you some time to be able to rest rather than staying up or waking up in the middle of the night to answer any phone calls coming in for your home care, your hospice, or your home health agency. It's also going to be able to help you guys reduce the cost. Instead of hiring a full-time receptionist, especially if you are in the beginning process of starting your business, you want to be able to reduce your costs at this very moment. We are HIPAA compliant. Also, when we want to contact you, we can send you messages via text message, via email, or even via leaving a voicemail in your current phone. Another thing is we are just one price service, right? We don't charge anything different for our after hours on our morning hour calls. Also, remember, we are industry specific. We only work with home health, with home care, and hospice agencies. Also, it's a month-to-month program. We don't have any yearly or 2-year contracts. So you just pretty much pay as you go. Now, we have 3 different plans. Typically, most of the people will sign up with our silver plan, which includes 100 minutes a month, which is $99 a month. And any additional minutes after that is just 95 cents. If you are starting your agency, you can start off with the basic plan, which is $39 a month, and you get an instant 20 minutes per month available for you. This is really good if you're just starting off your agency and you're still working a full-time job and you don't want to miss any phone calls. So sign up at this very moment to HomecareAnsweringService.com and stop missing those calls.
Everyone, we want to be able to invite you to our 10xPatientReferrals.com, where we have our online home health marketing academy that's going to be able to help either a home health, home care, or hospice agency increase referrals, increase their census, and create a profitable company. Now, at this very moment, you're going to have access to these information through these training, marketing to physicians, how to get to hospitals, how to be able to get into nursing homes, and much, much more at a month-to-month basis with no contracts needed. It's just month to month. Now, guess what? We are offering you guys for a limited time 50% off any one of our plans. Just choose which one is going to be able to work better for you. So just stop by the 10xPatientReferrals.com at any given moment. So these are the plans that are available, whether it's the gold, the silver, or the platinum plan. Most people go for the gold plan, but it's up to you what's going to work for you. We definitely want to be able to have you come in and work with us. So here's 2 choices. Go to 10xPatientReferrals.com or click the link down below. Take advantage of this right now at this very moment and sign up with us. Before we continue on to the video, just need to be able to take a few seconds of your time. And so we want to be able to ask you a question. Are you looking to gain more referrals for your agency, your home health, your home care, your hospice agency? We want you to be able to join us at our online marketing bootcamp that has over 7.5 hours of training. When you actually watch our bootcamp and join our online marketing bootcamp training, you're going to get a free month access to our 10xPatientReferrals.com. So sign up for a limited time at 10xPatientReferrals.com and enjoy all the content. So let's go ahead and get back to the video that you're currently watching.